MCPS class as usual, and this is very important class, and most of the questions are also asked at the PG level, at the graduate level, and even at the policy level. The building block of WHO of healthcare system, and sometimes it is also called public health system, not only healthcare system. And this is a community medicine field or public health field, and it is there. So next please. Yes, this is important, and you can give to the undergraduate, postgraduate, and they can explain in different terms. The number one on the top is service delivery. How you deliver the health care at the point of use, or at the user level, at the consumer level. And if that block is not strong, that is not scientifically proved, evaluated, impactful, then this weak block will affect the entire health delivery system. There is the health workforce. And for Pakistan, the data shows that for 10,000 people, we require 44 people, in which 10 doctors and almost 30 other staff, and we call it PNM, physician, nurses and midwives. We write down this PNM is very important word in the health delivery system. So how many you require? For 10,000, 44. And you will be astonished to know that in Pakistan the figure is 50. And this is 21st century. Even for Iran it is 36, and for UK it is 112. And we are trying to have these MD cares, the postgraduates, all the activities in Pakistan, and fancy hospitals and gamma knife and all these things. But they are not working. The workforce of Pakistan is short and imbalanced, and even their deployment or distribution is not smooth. In the urban area, you will find doctors. Suppose in Hyderabad, you go to the southern area, every 10 feet you will find doctor, consultant, laboratory. But if you go away from Mirpur Khas, then even in 100 kilometers, you don't find the laboratory doctor, not a specialist, even the MBBS doctor. Then is the information system, health information system. It is two-way, from patient to the system and from system to the patient. And we don't have such kind of quick real-time information system. Patient gets prescription, goes for 10-20 days, and then comes back and tells just through a physical presence. Access to essential medicine. 80,000 medicines are in the market of Pakistan, and their rates, their quality, and even their ingredients, we don't know what is the level of that. 80,000, particularly the prices of the drugs in Pakistan as compared to the neighboring countries are very high, or 2 times to 3 times. Even the procedures are very costly. If you go to the Karachi for any procedure, then this is costly. Then is the financing the GDP or the per capita spending on the health. Pakistan is not satisfactory. Even our entire education sector is underfunded. The health system is underfunded. And private sector is growing, which is always to some extent an exploitative system. And yesterday I showed the table in which the expenditure of the government is comparatively more than the private sector, but the satisfaction level of the patient is less in the public sector as compared to the private sector. So that is very important. And leadership and governance. The MCPH, MPH, MSPH, even the higher qualification in public health, They are supposed to upgrade and make the system resilient. Resilient means in difficult, challenging situation, even the system is functional. And why public health is now considered as an important building block? Because of specific situations in Pakistan. First, the Kashmir earthquake, which killed about 100,000 people. It was in 2005, and then in 2010 we had the breach of Indus and displacement of the people. Then in 2022 another heavy rains even and now the cyclones. So these situations are not normally dealt with the common curriculum, common training of the doctors. We require international support as well as the emergency response, not treatment. And for the emergency response, you must have inbuilt the system which can reach to the remote areas, to the most affected areas. Even I was in the flood of 220 division when the Dr. Nathan Shah was submerged in the water. Even the hospital was not visible, and only one doctor was with a stethoscope for 40,000 people. So what is this response? This response is not. So the governance and leadership is also important. Let us move to the third slide that might be most, you can see that the information, leadership, all are connected. One will make the other weak or strong. Next. This is another same situation, and here along with medicine, technologies are important because now the medical care is not only the doctor driven, but it is a technological driven. Lot of artificial intelligence, robots, management system, business system, they are there. Next. This is another caring for the complex patient. If you have multiple diseases, one study says that in Pakistan at least 5 diseases per patient are there if that patient is admitted in hospital. So how to deal with this complex situation, and then measuring the success in another. There is no after round, professor goes away, and in the 3 hours there is house officer or PG, and we don't know what is the fate of the patient. Next. So these are 6 building blocks and we are ending this lecture. Perhaps I think with the message that Pakistan is 5th largest country in the world, but from the health ranking it is 124th country in the world. So we are at the bottom as the health delivery system ranking, 124. This is WHO data and you can verify from any sources. So Dr. Sarkashwala YouTube channel as well as this class, and the purpose is not only to share the knowledge with the small group, but through technological use and social platform, anybody anywhere in the world can access and can write us comments, views, anything which is sharp in their opinion. Your criticism is welcome. And once again, the common question is what is building blocks and what are 6 building blocks, in which the service delivery is at the top and the governance and the leadership is at the very important rank or the number that is at the bottom. So we start from service delivery and reach to the leadership. Thank you very much.